We hope you're doing well. We thank you for joining in another San Diego Sports Association community conversation. We have three great guests joining us. Jeff Ward, the CEO of Next Wave Insurance. Milena Glusek, who I would like to introduce her as numerous time San Diego Sports Association award winner, but that would fall probably pretty low on the list of her career accolades. She is joining us as well. Finally, Christina Schur. I might be butchering that. I apologize. I've never actually asked you how to pronounce your last name, despite us knowing each other for so long. And she is the athletic trainer at Westview High School, also a big advocate in the legislative world for athletic training and being a certified athletic trainer. We have these three people on with us because right now sports are starting back up in all sorts of different staggering fashions. And that means a lot of questions, a lot of confusion about how to keep yourself safe, keep those around you, those you love safe, and keep the events that you want to have happening safe. So we brought these three people on to sort of answer some of the questions or maybe dispel some of the myths, give out some of the information. So Jeff, we'll start with the easy question for you. What is going on? When will we all be safe? When will this all be over?
Well, I don't know when we'll all be safe.
Joking with you there. No, but in all
I feel safe.
Yeah,
no one else feels safe.
Deal. But in all seriousness, no. Youth sports are coming back, and you guys deal a lot with keeping family members safe at Next Wave. So, kind of talk to us about maybe what are, if you don't mind starting with, what are some of the biggest things that you feel like are misinformation or misunderstandings right now that maybe you and Next Wave can help answer?
Well, we focus on providing policies of insurance to parents that have children playing in youth sports, starting with a product we developed with AIG and we distribute through NBC, subsidiary of NBC Sports called Sports Engine. So a lot of parents out there may recognize the name Sports Engine or SI Play, Sports Illustrated Play. So we work with their experts as well as the folks at AIG and their accident and health division to kind of monitor what's going on in the youth sports arena. And yes, things are opening back up, have been really since June. We had a 2 or 3 month shutdown from COVID where not many people were signing up for youth sports, but there's a difference between, the school sponsored sports, the clubs and the various leagues and whatnot. But we're not seeing a huge spike in anything related to COVID in our world.
So I think that's also part of what people need answers for right now, because COVID specific insurance is a little bit different than general insurance. And I think people just need some clarity on how they can keep everybody that they love safe going forward. So maybe is there a direct link that you can provide us at Next Wave or a central resource where people can maybe go get more information about what you guys are doing?
No, and we haven't seen much on how to keep children safe other than wear a mask. I mean, there hasn't been any real research put out yet relative to COVID on what to do or not to do. The studies are showing that children aren't as impacted as the older population by COVID. So we haven't seen a spike or a death rate per se. And so our policies are directly tied to accident medical policies and one product called Registration Saver, which is similar to travel insurance that you'd buy through an airline, but we tailored it for youth sports around the U.S.
If you don't mind giving us a little bit more information on that, I think that's what might be really interesting for people to know about right now, because so many of these tournaments are coming back and then you hear it's going to happen and then it doesn't happen and then people sign up and it doesn't sign up, and it's not necessarily COVID specific related. It's a lot of different financial situations, number of people signing up. So how can that tournament insurance really be applicable for people? What do they need to know about that?
Well, we developed the product 3 years ago. It's a form of event cancellation coverage designed for tournaments and camps, and there's another policy designed for a season. And it allows parents that have an injury, illness in the family, a death in the family, unfortunately, but really an injury is what triggered it, or bad weather, to recoup the non-refundable registration costs that they've absorbed signing their children up. In the U.S., with between age 5 and 18, a parent signs their child up to play a youth sport twice a year. So it happens about 110 million times a year. So we developed that product so that parents that are spending a lot of money, even on recreational sports and club sports, can get a refund if there is a problem throughout the year. If they lose their job, they're in the military, they get transferred. So that's number one. Number two is the registration saver product that we designed ever since Obamacare came in 9 or 10 years ago. Parents have had to take on a much higher deductible in their family health plan. So registration or MedSaver, which is medsaverinS.com, allows the parents, it's approved by the State Department of Insurance in California, but it allows parents to mitigate their downside risk if their child gets injured playing that sport. So it doesn't cover a COVID-related injury or illness, but it does cover the injury if they're during a sanction event. So those are the two products that we really distribute with NBC and Sports Engine, soon nationwide. Registration Saver is nationwide, but MedSaver is only in a handful of states just now, including California.
Certainly want to get more information on directly how people can get access to that. But Christina, if you don't mind, I'd like to ask you a little bit more of the athlete side. You as a certified athletic trainer have long been a very vocal proponent of everything being on the books, get everyone a certified athletic trainer, be very much above board across the process. So it seems like being able to take care of your athletes and be able to take care of your situation right now more than ever is important. What are you seeing though in terms of some of maybe the concerns that parents of student athletes are having right now about letting their kids return to action?
I actually think that's a very valid point. With all of the health considerations revolving around COVID and the risk of cardiac safety with a youth athlete, or even we're seeing it in some of the collegiate athletes, myocarditis being an issue. I think now having an athletic trainer in place to make sure that all the guidelines are being followed, that the appropriate paperwork and questionnaire, and also the return to play is done appropriately for a patient or an athlete that's been diagnosed with COVID, because that is a whole new arena for all of us. There's one that I'm aware of, one return to play program for youth sports on an athlete that's had COVID. And I think just having somebody to utilize that the right way to make sure that they're returned from the disease or the virus appropriately. But not only that, we talk, COVID aside, these athletes and young athletes might not have done any sort of extensive activity since March. So, have they just been running on the treadmill or running around the neighborhood? Have they just been doing some free weights on their own? Or are they, versus going straight into a full-on game? So I know for me, that's my concern when I hear that some programs are going out of state for competition, is that how have these athletes been trained or retrained, what we call reconditioning, since March to compete at that high level? And what type of risk does that do to them, soft tissue injuries or even long-term injuries? And I think the NFL right now is having a big question with the highest number of ACL tears in, the first 3 weeks of the season. Even with their athletes, what type of deconditioning or conditioning do they go through? So having a certified athletic trainer that's aware of all these policies, whether it's COVID related or just reconditioning, I think would be a huge addition to any youth sport program.
So Milena, if you don't mind jumping in, she brought up athletes who are returning to action right now after maybe a very long period out. What do you think would maybe be your most direct call to action or pitch to the parents out there listening who have athletes that are returning to action in terms of why they might want to take advantage of that insurance, COVID aside, but really just focusing on, like you said, soft tissue injuries and the possibilities of getting yourself more injured after being out of commission for so long?
I think that's just one thing that would be useful, is to know whether or not that's, because I know for me, for my liability insurance as an athletic trainer, if I'm working in COVID, I have to check and make sure that I'm covered under them, because it's what they consider a global pandemic, which it is, but I have to make sure that that's in my policy to do that as well if I'm covering outside of my school. So I think if that would be something for you guys, if a parent is concerned, you know, hey, we traveled to Arizona and our whole team got COVID, you know, and we were in the hospital, or whatever medical expenses they have, if that would be covered or not.
So for those, I'll explain it quickly. The two policies, the registration saver, reg saver policy just covers the registration fee. And there are, that the parent pays for their camp, their season, or their tournament. There are scenarios surrounding COVID that are and are not covered, and you can find those on our website. If you just go to reg saver, REG saver.com, you'll see under the hero image on our website a banner for COVID. Click there. It'll take you to the COVID page. A pandemic was never named peril in the policy when it was written years ago. But that being said, if the child becomes sick with COVID, that is a covered peril. And there's a few other scenarios, but if the event's canceled due to COVID, that was never named peril under the policy. Then the Med Saver policy is different. That just covers up to $5,000 of the parents out-of-pocket medical expenses, and that is for a sanctioned season. So if a child's participating in a sanctioned practice or sport for that designated season in which they bought a policy, and the child becomes injured, to go to the hospital or out-of-pocket medical expenses, the parents can recoup up to $5,000.
Med Saver, the one that's only in certain states, and is that
correct? Correct. So Med Saver right now has been approved by the California Department of Insurance, New Mexico, I believe Pennsylvania, Oklahoma, and Texas, but I need to check.
If the injury occurred in California, same example, they go to Arizona, but they're a California team.
No, that doesn't matter. It just depends on where the child resides. So if the child resides in California, the parent can purchase a policy. But if they're traveling, that child gets injured in a sanctioned tournament that was part of that season. And we say sanctioned because we don't cover if Johnny decided to go skateboarding during football season and fell off and broke his arm. That's not covered. It has to be during a sanctioned practice or game for that season in which they bought the policy. If that child's competing in multiple seasons, let's say a lacrosse season and a soccer season that happen to overlap and be at the same time, the parent would need to buy one policy for each season.
How wide ranging of an age group are we really trying to appeal to right now? I mean, is this something that you can sign up for if your kids are 8 years old playing Little League travel ball, or is this more tailored towards high school type experiences? Who is the people that we are speaking to right now?
The registration saver policy applies to anything that you are signing up for that you pay a registration fee for. So if you're an adult competing in an adult softball league, you can buy the policy, or adult hockey. But the majority of our policies are sold via youth sports because that is, such the trend and so popular right now. But like I said, if you're an adult competing, you can purchase that policy.
So I can cover myself when I get out of bed funny and tweak my back and begrudgingly admit that I've turned 30 finally, and that it's all downhill from here. I've got that. You've got that covered on me too? Okay,
exactly.
Deal.
We have that covered. If you're competing in, let's say, a half marathon or marathon, you become injured, you could purchase the policy and seek reimbursement if you were injured.
Jeff, what are some other
target?
Yeah,
I think the target age group is for us is 5 to 18, age 5 up to 18, and then adults is fine, and we're doing a lot of high school athletics as well. But yeah, it's the youth sports and the high school athletics is really our target. The adults get injured too easily, so we don't sell too many policies in that space.
The high liability and low return on that. 5 though, that's where I was kind of trying to understand what that younger side of that is. That because I'm sure that I don't even really understand how large the numbers are, but it seems like the numbers are constantly growing for these youth sports. Christina, I know that high school sports have ballooned up exponentially over the last 5 years. CIF keeps getting larger and larger numbers, but that also means the number of club teams playing in the off season. So, I mean, can you just kind of help echo that? I'm sure you see a number of kids coming into their high school season with corresponding injuries from that club season. Their shoulders are hurting, their ankle, like whatever it is. You're already laughing at me because I'm talking about something so low hanging. So this seems like a very real thing that parents should be concerned about, is keeping their kids as protected as possible going into a high school season?
Well, absolutely. And you kind of touched on a nerve there when, we're going into our typical winter season. And I'm already treating 5 concussions that happened in, the big soccer tournament over Thanksgiving break, that doesn't have athletic trainers. So they don't have appropriate paperwork. They haven't seen the appropriate healthcare provider. So then, that ends up, on the high school athletic trainer taking on, that recovery of that athlete, whether it's a concussion or a hamstring or an MCL, that not having the appropriate care, during those club sport activities that don't have an athletic trainer really kind of slows down the process. So once they do get to me, we're almost backtracking. So I think, by having the appropriate coverage appropriately and early, it kind of helps once it transitions into high school. And then for me to kind of step over or step into and take over that care. So that is definitely a pattern that I see in not just soccer, in many sports. Or, if they're playing 2 sports, they're a club volleyball and a basketball player, then you're kind of, having to decide, putting it on the student and the parent, are we going to rehab for both sports, or can only rehab for one sport at a time? You got to pick. So that's where it kind of becomes a little sticky, and especially knowing that the club sports don't really have a healthcare professional or athletic trainer to work with them, and it's just me.
If you want more information, we'll include all the direct links for Next Wave Insurance and how you can get infinitely detailed more information there, as well as links from Christina on how to really understand what a certified athletic trainer means and how you guys can help keep yourself at least educated on what are the best ways to keep everybody safe. Any details that you would like to just bring up, closing notes, Jeff?
No, they can, the parents, if they need us, they can find us on regsaver.com and medsaverins.com. And they can read up on the policies if they're interested. But the new one that's really gone over big in California is the MedSaver, because the deductible that families are incurring in their family health plan, and if the child gets injured and they go to ER or urgent care, they're going to be out $2,000 or $3,000, and we'll cover that first dollar.
I have a bill from my parents pending, I'm sure, for all of my childhood accidents and injuries because of those bills. So I don't even actually want to know the total number there. Please don't say that 2,000, 3,000, because you're hitting me with some retroactive guilt. But I really appreciate you shedding some light on that, because that's something that I think a lot of parents and people out there who are caretakers really need to know. Milena, we'll close with you. Are you surviving this as an athlete? Are you able to still get out there and stay sane and keep physically active? Will you be returning to be our athlete of the month sometime soon? Because we're starved for any sort of athletic entertainment in San Diego.
Well, I am happily retired. However, thankfully, the 2 sports that I enjoy doing now, tennis, which I did play in college, as well as golf, are outside and socially distanced properly. So been able to get out and do that. But, during the pandemic, when things were very closed, I was able to get my workouts in, just creative, go outside for a run or a jog, push-ups, sit-ups. We were fortunate to create a home gym, which is great, but you can be creative and stay outside and stay healthy and active.
Well, we are glad to hear that everybody's staying safe, everyone's staying active. Thank you again, everybody, for joining us here on our panel. Thank you, everyone, for tuning in and watching. As I said, we'll include links below so you guys can get directly to all of the information here and take some action on that and help educate yourself and help arm yourself to be as safe as possible for you and those that you love. Thank you, everybody, for joining us. Stay safe, and we'll talk to you next time.